Hello, my lovelies, and welcome to Where the Road Rises, Law, Lessons and Legacy, with me, your host, Eileen Curlin-Walsh. We're excited today to share valuable information on a subject we have not tackled before, case management as a critical component of your healthcare. Case managers plan, process, coordinate and monitor the often dizzying array of healthcare services delivered to a single patient by a wide range of providers. Navigating that complex system is difficult for all of us, but even more so for seniors who need increased services just as their ability to coordinate them is diminishing. Case managers can provide life-saving help, but no one generally knows how to find one or how to connect with them. So we're going to fix that today because we have the rock star of case management in our studio. Dr. Colleen Morley has 14 letters after her name. She is the Director of Case Management Services for West Suburban Hospital and Westlake Hospital. She is Chicago President of the Case Management Society of America and owner of Ultra Healthcare Consultant. She holds multiple directorships, has won many awards, and has been widely published in her field. She is passionate about research and education and teaches medical providers, caregivers, and care professionals in the community to navigate healthcare for patient safety, quality of care, and cost efficiency. And we are delighted to welcome Colleen today.
Thank you.
Hi,
Thanks for
Colleen.
having me.
Well, we're really excited about this subject because so many of our viewers are seniors and deal with multiple healthcare providers. So it's absolutely needed. Absolutely. So let's start with you. Tell us a little bit about your story, how you came to this field, and how you got to where you are today.
Well, let's see. I'd always wanted to be a nurse from the time I was very tiny. I grew up literally inside of Weiler's Children's Hospital at University of Chicago. My brother has cerebral palsy and a couple of other things that went along with it. So I spent a lot of time at Weiler's hanging out in the surgical waiting rooms and visiting my brother and things like that. So I kind of always wanted to be a nurse. I knew I was going to head in that direction, but my life kind of took me on a little turn here and there, and I ended up in the financial sector for 11 years before I actually went to nursing school in my late 20s. Decided that a lot of changes were going on in my life. I was a newly single mom of 2. And my daughter was 5, my son was 1. And said, you know what, if we're making all these changes now, we're gonna go ahead, we're gonna shoot for the moon. So I enrolled in nursing school and graduated in a couple of years and started working in nursing. About, oh my goodness, 3 or 4 years later, I was married again and I had another baby. And unfortunately, this baby was very, very sick. And so it's been a roller coaster of up and down and you know, trying to coordinate care for him. He's got multiple medical issues. And at that point in time, I was working on the floors, 3 to 11, 11 to 7s at night, things like that, just trying to figure out how to make a schedule that would work. And then unfortunately, we got divorced. So here I am again, single mom of 3 now, and I have to figure out what I'm going to do with this very, very sick baby.
Child, yes.
One of my girlfriends came up to me at work, and she and I had followed each other through a couple of different hospitals, and she said, I found the perfect job for you. And I said, well, okay, great, you know, what's going on? Monday through Friday, 9 to 5, no weekends, no holidays, great benefits. And I'm like, okay, you've sold me already.
Sign me up.
Sign me up. So it turns out it was with an insurance company as a case manager. I'd never heard of case management before in my lifetime. Even at the hospital, we didn't know who the case managers were or what they did because it's the best kept secret in all of medicine, by the way. So, you know, I followed her advice, and it was truly the best blending of my financial career and my nursing career brought together. Yes. And I really felt like I'd found my home. So when I left the insurance company after 5 years and started back in the hospitals, in the case management departments, it's really come full circle for me. And now I'm able to figure out what's going on with the patients and not just manage them from afar, but manage them in person. I was always that nurse that, you know, as you're discharging a patient, you're pushing them out the front doors of the hospital. You know, most of the people are like, okay, that patient's discharged, let's move on to the next one. My brain would be working with the what's going to happen next.
Yes.
And that was always my question with every patient, what's going to happen next? And case management truly manages what happens next.
Yeah, and isn't it amazing how these disparate elements of our lives, we think they're so disconnected.
Absolutely.
And then it turns out that they were all bringing us to where we really needed to be. And we look back and it looks like directed research.
Exactly.
I love that.
I actually had that conversation with my father yesterday.
Yes, yes. Now, so tell us exactly what case management is.
Okay, so I'm going to rely on some notes here because I want to be incredibly specific. Being a representative of Case Management Society of America, I need to get the definition out there.
Okay.
So, case management is a collaborative process that means that we work together with all the healthcare disciplines. So your doctors, your nurses, your physical therapists, your occupational therapists, everybody who's touching you, pharmacists, etc., of assessment, planning, facilitation, care coordination, evaluation, and advocacy. We are the patient's advocates. You know, what's the best thing for the patient? What does the patient want? And we kind of speak as the voice for the patient as well. For options and services to meet the patient and their family's needs, to promote safety, quality of care, and cost-effective outcomes. So that's the official definition.
Okay, so how come we haven't heard of case managers? And who pays the case manager? Is it the insurance company? Is it the hospital? Is it the patient? So how can you advocate for the patient if the patient... I'm curious to know who pays the case manager and how do we remain neutral to take care of all those different bodies within one's care?
Okay. At the core of case management is our professional licensure. We are licensed by the state of Illinois or whatever state that we're in to be nurses, to be social workers, to be physical therapists, occupational therapists, etc. Under that licensure, we, you know, I'm sure you've heard of the Hippocratic Oath, do no harm. Well, nurses have the same kind of an oath as the Nightingale one. I'm sure every other discipline has their own oaths. But at the core of it, that licensure says that we put patients above everything and anything. And so regardless of who's paying our check, that patient is our main concern, the patient and their family.
And I absolutely don't doubt that, Colleen. But it's the so who
Everybody. Everybody pays for it. So if you're dealing with a case manager who's hospital-based, the hospital is paying that case manager to make sure that the patient is getting the services that they need. If the insurance company is employing that case manager, the insurance company is paying the case manager to manage the patient and connect them and coordinate them and bring everything in, you know, into focus so that there's not considerable readmissions or there's not a lack of services. Some case managers actually work independently, and the patient and their family actually hire them and pay them. So there's the answer to your question is all of the above.
Right, and the cost efficiency is going to work for every single, including the patient, because often they're going to be paying their portion of the bill too.
Exactly.
So you mentioned patient advocacy. So could you tell me where the role of the case manager, the patient advocate, and the social worker, how are they different and how are they the same?
Okay. Social worker is a licensure. It is somebody who's basically working specifically on social issues. Lots of social workers I know actually have private practice where they do counseling and things like that. Nurses, we can work in hospitals, we can work in the community, we could do a lot of other things. But as case managers, we are focused on coordinating and everything I just said, an assessment, the coordination, and everything from there. Patient advocates is a relatively new addition to the healthcare world, where there's people who are out there and they are working as patient advocates, and their main goal is to be the voice of the patient. Now, case managers and social workers, and well, social workers are also case managers, but case managers are also patient advocates, but these patient advocates that I'm specifically speaking of are directly hired by the patient and their family to be their voice out in the community, you know, to coordinate appointments, to come in and say, you know, we're concerned about this, and this, and advocate for them specifically.
Right. And who can benefit from having a case manager?
Everybody can benefit from having a case manager. We usually will see patients who have many chronic conditions, so somebody who has chronic obstructive pulmonary disease and congestive heart failure, and maybe they have cancer on top of it, and that makes a very complex mishmash of stuff that you need. So those are very high acuity patients. So what we're doing is we're bringing everything together so that we can say, we need to treat this, we need to treat this, we need to treat this. How do we treat it the best for this patient so that they get the outcome that they want? But everybody actually could use a case manager because the healthcare system has gotten to be so incredibly complex that just trying to find your way through it is impossible. And I've got a great story for you about that a little later on.
Jump right in if you want to tell. We love stories.
We, CMSA Chicago, had this awesome project last year, and it's basically, we put out this little book of stories. We call it kind of Tales from the Front, but it's actually titled Case Management. It's not luck, it's skill. And basically what it is stories written by our members, nurses, social workers, and all the other disciplines, about either memorable patients, process improvements that they put in place to make things work better, or actually the reason that they became a case manager. So one of the things I'd like to read from you out of this is a little scenario, because this is one of those stories that actually shows how everybody can use a case manager. I'm going to preface this by saying that this is about my mother. My mother is a retired critical care nurse of 38 years.
Oh my.
One of the smartest women I've ever met in my lifetime. Okay, not much gets past her. Okay, so she is seen by her physician every month. She goes to the doctor every month. My mom's got several medical problems. She's got a couple of things here and there, but nothing that was actually triggering it. But she keeps up on her health, so it's a very good thing. She complains of weight loss and confusion. She's given referrals to specialists and told to follow up. Month after month, it's the same story. So she started seeing the physician in June. 10-pound weight loss, 20-pound weight loss, 30-pound weight loss. Month after month, I was looking at the documentation. Month after month, we're seeing 10, 20, 30, 40, 50, up to 62-pound weight loss over a 6-month period of time. She wasn't doing anything to actually lose weight. My mother is 4 foot 10 inches tall.
Oh my.
So you can imagine a drastic weight loss like that is like, wow. The referrals sit in her purse because now she can't figure out how to navigate the phone tree at the specialist's office. This is a critical care nurse who can't figure out how to get to the specialist on the phone because with the weight loss, along with that comes the increased confusion. The weight loss continues month after month. The confusion continues month after month. She cannot, now by the time this is December, she can't figure out how to work her cell phone, much less make the appointments. She's embarrassed to tell anyone that she can't do these simple things, so they go undone and her health continues to decline. My mother met her husband on the internet in a senior dating site.
What a girl.
And now she can't work her cell phone.
Yeah.
That's a huge red flag to me.
Yes.
So my sister and I went down to Missouri, where she's currently living, and was speaking with her gerontologist. No case manager and no social worker in the practice. Just really great documentation of weight loss and confusion. And the doctor couldn't understand why she hadn't followed up with the neurologist that she gave her the referral for 3 months ago. And my mother was just like, I don't even know how to get to the neurologist. Am I supposed to pick one? What? This is a perfect case of this is somebody who needed a case manager in the office. My mother was diagnosed with Parkinson's 14 days later, and Parkinson's dementia as well.
Right.
And this could have been headed off months earlier.
So that bewildered patient, how would they have found a case manager?
Well, there's several options. If you're ever in the hospital as a patient, you've got social workers and nurse case managers who are working in the hospital. They have to come and do an assessment on you within 24 hours according to CMS guidelines. So take advantage of that opportunity. Don't be afraid to talk to the nurse case manager or the social work case manager about what your issues are, and don't just say, oh yeah, everything's great, because now you've lost an opportunity to connect. Also, if you have any form of insurance, all you got to do is flip over that card, call that number, and say you want to be connected with a case manager. Every insurance company hires and employs a phalanx of behavioral health case managers, medical case managers, complex case managers to manage their patients.
Right.
And in the community as well.
Yeah, and it is not well known.
No, not at all.
It's certainly not well known. What can we do? Because when you spoke about your mother and you spoke about the scenario earlier where there's maybe 3 different health conditions and specialized medical providers are going to be dealing with each of those conditions separately, are any one of those responsible for making sure that the treatments are not going to contraindicate with one of the others, or is that the patient's job, or is that where a case manager is going to make sure that their treatments don't conflict and hurt them?
That's exactly it. My conversation with my mother's physician was, do you not have a social worker or a case management nurse here in your practice? This is a very big practice at a very large medical center down in Missouri. Do you not have somebody that can help your patients navigate through this? Because she's a gerontologist. Over 65% of her patients are over the age of 65. Right. You know, this is a huge risk population. So why do you not have that in place? So that's one thing.
Yeah.
Excuse me. But the other thing is that, and I've seen it a lot over the past 15 years of being a case manager, when we walk in the room, you know, patients they're too embarrassed to tell us that there's issues, or, you know, everybody's trying to, like, you know, just get in and out and not, you know, I just want to get better and get out of here. Take the opportunity and take the time. And even if you've been discharged from the hospital and you're having issues, feel free to call back to the hospital and say, hey, you know, can you help me out? Can you connect me with somebody that can help me in the community? Because there are community case managers as well, and we are more than happy to make those connections. That's our job, and that's our passion.
Right, Colleen. So I'm thinking, my husband had a heart attack a couple of years ago. He comes out of the hospital with all these different appointments to see various providers, and we were absolutely deers in the headlight. And there were some treatments for his lungs that didn't match up with the treatments for his heart. I know many of us here in Palos Heights have had a family member have a stroke, have a heart attack, get out after cancer treatment. And we don't know how to coordinate all of that. So on a very personal level, one of our Palos Heights or Worth viewers would love to get a case manager to take a look at their various health providers and conditions. What would they do? Would their first call be their insurance company?
Their first call would be their insurance company, absolutely, especially if they're not in a hospital, because that's going to be the person who's going to be driving the case and coordinating everything. They have all of the data and all the information about the appointments that were made, all the lab data, all the information about the hospitalizations and the conditions, so everything is right there. That's the best person that can take advantage of the opportunities to move things along.
Right.
And if you feel uncomfortable with that, then there's also community case managers that you can contact. Several different companies in the area, and if anybody's interested, they can email me at CMSA Chicago.
Beautiful.
And we'll be more than happy to kind of find you somebody to work with.
So are you saying, Colleen, that the information is out there, but because of our unfamiliarity, we're not hearing it?
Absolutely. Like I said, we're the best kept secret in all of healthcare.
So a doctor, at some point during my husband's 12-day stay in Christ, someone probably came and told him about a case manager, but he didn't hear it and I didn't hear it.
Probably the case manager came in and said, hi, I'm the case manager and this is what I'm going to be doing.
Yes. But so I think that's terrific for our viewers to get this information. All right, you told us one story about your mother. Tell us maybe another couple of stories from the front about an awful case, your mother, in your mother's scenario. That was definitely a cautionary tale. What about a success story?
I've got a perfect story. And if anybody's interested, this book is available on Amazon, and it's an awesome little read. And it really, I mean, it's heartwarming. It's just shocking at what goes on in the world. But I'm going to read you a story that was written by one of my co-workers at West Suburban Medical Center. Her name is Ellen Walker. She's a social work goddess. I just adore her. It's called William and the Aligned Planets. It says, there comes a time when all the planets align and all is proclaimed right with the world. It doesn't happen often, but it does happen. Here's one story when it did. Please meet William. William came to our hospital with an infected wound on his foot, but in truth, his troubles were greater than what he presented with. When I first met William, he was an affable but guarded patient, willing to answer questions, but only to a certain point. Then he started to be evasive. The next time she went in to speak with him, he was in full-blown withdrawal from his heroin addiction. During this admission, his discharge concerns continued to mount. He was homeless, uninsured, without an income, without family or any social supports, and did not have a primary care physician either. All these issues made it difficult to obtain the medical care that he needed to heal his infected foot. He needed antibiotics, a substance abuse program, a clean place to change his dressings, follow-up at a wound care clinic, a primary care physician, and lastly, transportation to all of his appointments. So while he was with us, we were able to whittle down these issues one by one. After meeting with him a few times, he was agreeable to try the Suboxone program for his heroin use issues. One of the hospital's affiliated clinics had such a program and was happy to enroll him at no charge. Our hospital physician was also on staff with the same clinic and was willing to continue to see William as an outpatient despite of his financial status. We involved financial counselors who helped William begin his application for Medicaid and were able to find him temporary but transitional shelter at a facility that worked with the homeless that are in need of medical care. We have all these resources tucked away. William now has a place to live for a while he could care for his foot in a clean environment. Nothing like changing a bandage on the street. We got him hooked up with our wound care clinic, and after some advocating, they were willing to see William, although his insurance hadn't been approved yet, and they monitored the healing of his foot ulcer. The hospital's medication program was able to provide William with his antibiotics, and during discharge, the nursing staff provided him with extra dressing supplies to hold him over until he could get to the wound care clinic. Finally, the hospital provided bus passes for William to get to all of his appointments. I met with William about 2 or 3 times a week to check in with him and provide the needed bus passes. 4 weeks into our relationship, I saw William. He stated he was doing well. He was still attending the substance abuse program and had remained abstinent. He was continuing with the wound care clinic, and his foot was doing much better, well on the way to being healed. I offered him some more bus passes for transportation. He declined, saying he didn't need them. Red flag went off in my head. I said, "How are you going to get to your appointments?" He smiled at me and said, "I got a job." He had started the previous week and was getting his first paycheck that very day. Grateful for all that we had done, but did not want to continue to take what he didn't need. He turned, gave me a huge hug, and went off to work. 3 months later, still substance-free, the wound was healed, still working. He'd found an apartment and was making a headway in rebuilding relationships with his family. The stars and planets had aligned, and he was following their path. And that's what case managers and social workers do. We give the push in the right directions for others to have their needs fulfilled.
That is lovely, because it's also filled with the milk of human kindness.
Exactly.
Not just the coordination of the care, but that it was delivered with such kindness.
That is the core of case management, is that soul to soul. We recognize that you've got issues and problems. We specialize in looking at the social determinants of healthcare. I mean, it's the new buzzword in healthcare these days. You know, do we look at, is the patient homeless? Do they have access to food? Blah, 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 blah. But case managers and social workers have been looking at that forever.
Yeah.
It's not something new to us. It's social determinants of healthcare.
Yes. Oh my. So that leads me to my next question. What do you love most about what you do? Could you articulate it? And is it just that you get to really?
It's exactly that. I mean, from those days where I used to be a floor nurse and I'm wheeling the patient out and I'd be going, okay, what's going to happen with them next, and worrying about that. I mean, sometimes it kept me up at night. Now I know that they're taken care of. Now I know that they're connected. Now I know that they're going to be going on to the next step. Now keep in mind, people have a right to make bad decisions, and their plan's not necessarily my plan, but they can always come back to us and we can work together on it.
Yeah. Could you maybe walk us through a scenario from the beginning of your involvement to the end? Someone goes into the hospital, has a surgery, they have multiple conditions, they have several healthcare providers, doctors, and facilities. So could you walk us through from being appointed to when you do no longer need to work with that patient?
Sure. Well, when a patient comes in the hospital, we go and see every patient within 24 hours of their admission to the hospital, and we do an assessment. Actually, we do a screening, and if they fall into one of the categories of needing an assessment, we do the assessment. If they don't necessarily need any services and they haven't identified that they need anything, we're still available for them. But we're telling them, you know, we're not necessarily going to come back every day while you're here. But then if they need an assessment, we do a full-scale assessment of their needs and start working on coordinating the care with the physicians, all the physicians that are involved, nursing, all the therapies, all the adjunct services that go into making up your hospital experience. So pharmacy, all the therapies, everybody that's involved, the wound care nurse, you know, stroke coordinator, depending on what's going on with the patient. And we work with that team to coordinate a discharge plan with the feedback from the patient and the families. keep in mind that, like I said, sometimes we're sitting here going, you know what, we don't really think that the patient's family has an idea of what it's going to take care of the patient when they go home anymore, just based on our interactions with them. And we're recommending, more therapies, or we're recommending that a patient maybe, finds custodial care, things like that. And the patient and their family are like, no, we want to go home, we want to give this a trial. That's great. We're going to set you up with as many services as is humanly possible so that we can at least support you in that. So we work with community services like Department on Aging or Department of Rehabilitation Services in the community to get homemaker services or home health aides and things like that in the house to be able to support them and help them out.
Yeah. Oh, that's
so as the time of the patients in the hospital goes on, what happens is we meet with them day after day after day, solidify the plan, find the providers that the patient wants that's under their insurance, because we want to make sure that there's not going to be huge out-of-pocket costs for them. And then we get it all squared away, tied up with a nice little bow, and move on. And discharge the patient, and then we follow up with them afterwards to make sure everybody got with them and that everything's going well. And sometimes they come back to the hospital because things weren't going so well, and we start all over again trying to figure out what went wrong with the discharge plan.
Colleen, you are now have your doctorate. You're in charge of the case management at 2 major hospitals. You are the president of the largest case management society in America.
I'll be president next month.
Almost. President-elect. So is that the pinnacle? Have you achieved where you wanted to go in life? Is there something else that you still want to achieve? And what is your proudest achievement to date?
I'll start with that because it's actually easiest. My proudest achievement to date is I have 3 incredible children and 1 incredibly gorgeous, phenomenal grandson who's 14 months old, who is the light of my life. And so personally, that's my daughter is a chef. She's married. She's been married for 5 years, 6 years now, I think. And they've got my little Brahmi. I just adore him. My oldest son is 25. He is an incredible performer. He and my son-in-law own a business, a painting business, but my son is also a professional wrestler, and he's following his dream with that too. My youngest son, my problem child, the one that
all his healthcare problems?
All of his healthcare problems have gotten squared away. He graduated high school 2 months ago, captain of his swim team. If you knew him 10 years ago, you wouldn't recognize the child that he is, and he's going to college next month. So it's a beautiful thing. So that's my greatest achievement. That's my proudest stuff. Professionally, am I at the pinnacle? No, absolutely not. I'm not at the pinnacle. There's always more to give, and there's always more to learn. Even though I've got my doctorate, this year I'm sitting for 2 more certifications. So those 14 letters you talked about, there's going to be 7 more after that. I'm a lifelong student. I can't stop. I've actually thought about going back to school and getting my social work degree, and then I was kind of brought back to reality by a couple of people going, yeah, we have other things for you to do, and you pray on it and you go forward. So, but there's always more. There's always more to learn.
And what footprint would you want to leave in the world?
What footprint do I want to leave in this world?
What would you want to be remembered for?
I want to be remembered for making a difference in my chosen profession. And nursing is my chosen profession, but case management is my chosen specialty. I fell into it by accident. I adore it. I love it. I will advocate for it until I can no longer breathe. I am the advocate for the advocates. Any given day, I'm getting emails from other case managers asking for assistance with this or direction on this or what do you think about this, and those are the emails that mean the most to me, is that my peers look to me as somebody that can help them, and I will continue to do that until I can no longer breathe.
This way your influence is even wider because you're teaching them to do what you do for so many patients. So if any of our viewers are listening, are professionals who'd like to coordinate with you, what is the best way for them to get a hold of you? Is it through your consultant company?
The best way to get a hold of me, there's a couple of different ways. You can either get a hold of me through Ultra Healthcare Consulting. I'm on the internet. It's ALTRA, Healthcare Consulting, and the email address is cmmorley@ultrahealthcareconsulting.com is the longest email
We'll get
ever.
it on the screen.
And then, or you can email me at the CMSA website as well,
Beautiful.
for CMSA
Beautiful.
Chicago.
Oh, this has been wonderful. What about a closing thought? Do you have a favorite poem, quote, something that sums up your big theory of life?
Yes, actually, that which does not kill you makes you stronger.
Indeed. Indeed.
And I've been through some storms, and it's been an interesting ride, and I'm looking forward to the next half of it.
Lights and shadows and everything.
Absolutely. It all creates who you are, and I'm pretty happy with who I am.
Colleen, it has
Thank
just
you.
been a delight, and that's wonderful information for our audience. So if you want to get a hold of Colleen, you have her information. You can always get hold of my guests through contact me at the law office, Carolyn Walsh Law. Thank you for watching. Let me know if you have ideas for future guests or shows, and I will see you next time on Where the Road Rises.